Okay, on page 61 on Unit 10, you will see at the bottom where it talks about antidysrhythmics or antiarrhythmic drugs. These are drugs that help restore a normal sinus rhythm to your heart. Now, if you will look at those drugs with me, propranolol, LOL. What did I tell you about LOL drugs? They're beta blockers. Wait a second. I thought beta blockers were antihypertensives. They are. They are, but they can also be used to treat something like AFib, atrial fibrillation. So, which would make it an antidysrhythmic drug, because remember, beta blockers are going to slow that heart rate down. Okay. You can also look at something like diltiazem and some of those others. They are all antihypertensives. So all of these that are listed here are antihypertensive drugs that are also used as an antidysrhythmic drug. So it doesn't matter what the name of the antidysrhythmic drug is, they all have the same side effects. Slower pulse, and orthostatic or postural hypotension, a slower pulse and a lower blood pressure. Okay? All right, moving on. Anticoagulants. I'm against. What are you against? Coagulation. So these are drugs that cause the blood not to clot so much. So anticoagulants or blood thinners, you might have had them called. My example for you, the one you need to know, is Warfarin, which is generic for Coumadin. Very common drug. This is another one of those drugs we love to hate. So Warfarin, 3 tiny words. Okay, Coumadin. All right. Now, vitamin K is the antidote to it. So if you accidentally gave way too much Warfarin and they were hemorrhaging out, because it thins the blood, right? What if it works too good? What happens? Now they're bleeding out, okay? So if that were to happen, vitamin K is the antidote, because remember, vitamin K clots the blood. Okay, so they take just a tiny bit amount of Coumadin. I mean, a little bit. The difference between 2 milligrams and 3 milligrams is huge. So we have to do an INR. That's the lab. You do an INR lab draw every whip stitch. I mean, some of these people get their INR drawn weekly. And depending on what the INR is, they're going to change the dosage of the warfarin. So you're constantly chasing your tail on this, and it's very frustrating. And one of the reasons for that is their diet can really make a difference. If they have pumpkin and spinach, guess what? Those are high in vitamin K. So yes, their INR might be too low. And so then they increase their warfarin, their Coumadin, and guess what? Next week, it's too high. And so you're constantly moving the dosage back and forth, and which causes that to be at very high risk for error. Can you understand that? In fact, it's one of the most common drugs to get sued on, because when that order changes, lab comes real early in the morning, right, and draws blood, and then it has to go back to the lab. The blood has to get spun and tested and everything else. Then the results come back to you. You look at the result, then you call the doctor and you talk to the gatekeeper, and then that person has to wait till the doctor's out of the room for a minute, tell the doctor, hey doctor, Flossie Mae's INR is blah blah, and then he'll say, oh, we'll tell them to change the dose to blah blah, and then they have to call you back. You have to be at the nurse's station, write that order, send it to the pharmacy, and the pharmacy sends it. Do you see where I'm going with that? The pharmacy has to bring it in, then you have to pull the old dose and put the new dose in. And about that time, a few days later, they get it tested again, and it's going to change again. Can you see how that would be a huge risk for error? Some nursing homes don't let med-aids give warfarin, their Coumadin. Some nursing homes do. If your nursing home does, I suggest you find out if they have a Coumadin flow sheet, And if so, you look at that every time before you give that drug, because it can change on a daily basis. It's just something you have to keep up with because the side effect is so intense. Hemorrhage. You know, if they're on, we had a guy that was on a decent sized dose of Coumadin, which like 3 milligrams is big, and he nicked his face shaving. We had to put a pressure bandage on it. I mean, you could hardly even, barely cut it, but we could not get it to quit bleeding because of that Coumadin. Can you imagine if they fell and really cut their head or hit their head hard? They can get subdural hematomas. They can die from these internal bleeding. And you think, I mean, you'll get sued if they find out that this was not followed. So be very careful of your Coumadin. Okay? So what is the side effect to this anticoagulant Coumadin? Bleeding, hemorrhage. Now, having said this, there are several newer ones that are not in your book. You might have heard of Xarelto or perhaps Pradaxa, or there's just so many new ones out there. Some of them have antidotes and some do not, but all of them carry risks. Not as much as this one. Nonetheless, there are things to keep in mind, especially if your resident falls. Make sure you know the protocol for that. Okay, so to finish up, I want to say that at the bottom of 62 and top of 63, you'll see hemantics, and this is where they're talking about iron and vitamin B. Remember what I said about anemia? Anemia is because you don't have enough red blood cells that carry the oxygen to your cells, and it's a lack of oxygen actually that's causing you to feel tired. And you don't have the oxygen because you don't have enough red blood cells that carry the oxygen. So you may have to take oral iron to help build those red blood cells. In saying that, you probably are aware the side effects of iron can cause GI upset. It can cause some constipation or diarrhea. The stools are always kind of a black tarry. If you give an oral iron, you should give it with a straw if possible so it doesn't stain the teeth, if possible. Also a vitamin B, especially B12, helps treat anemia as well. So, having said that, cardiac drugs have side effects that nobody likes. People don't like taking their cardiac drugs alike, but if you have a resident that doesn't want to take it, don't just say, okay, she refused. If she's declining it, find out why, because there's lots of different options for them that perhaps the prescriber could try. There's also education. If they know that what this drug is doing in their body and they can understand it. Sometimes it's just a dose change or the time of day that you give it. But just understand that it is one of those medication groups that don't exactly make you feel great all the time.